Hi, my name is Brian Warmers. I'm one of the nursing faculty at the University of Sioux Falls, and I'm going to be teaching NUR447B, which is Pediatric Nursing 2. So within this course, of course, we're going to be talking about children. So we'll be talking about them from newborn to 18, generally speaking. We're going to talk about education, health promotion. We'll talk about culture. We're going to talk about development issues a lot. We'll talk about specific care of kids, and then we'll talk about health illness spectrum across different systems bases. So within looking at this, these are some of the things that we'll look at, looking at the child as a client and what makes them unique. We'll be looking at children and family using different theoretical frameworks. You will see early on that the class is going to be heavy on theory for the first third of the class. And we talk about developmental assessments, we talk about theories, we talk about those kind of things. We talk about characteristics that will put these kids at risk. And then we'll start moving into more what you're used to with like a med surg and talking about more systems based. So that being said, we're going to be talking about professional manner and how to interact with kids and their families and the healthcare team. We're going to talk about how to do a head to toe and how to look at their H&Ps. So we'll do anticipatory guidance to see what's coming up for the kids and how we can best help them. We're going to look at cues, clues. We're going to look at a hypothesis and looking at how to care best for patients and their families. And then finally looking at quality and safety issues. So we'll do a lot in this course. And we'll talk about it here quite a bit. So as a review, here's your syllabus. Within the syllabus, of course, this is for the University of Sioux Falls. This is for fall semester, August 22nd through December 8th. This is going to be, you'll have class on Mondays from 1 until basically 3 up in the Jeske Fine Arts Room, 205. This will be with me. This is ways to contact me. This is including my cell phone, which is right here, my office phone, which is routed into my cell phone, just so you know. So if you call it at 2 o'clock in the morning, trying to get a message left, it will ring directly to my cell phone. Here's our fax number. Here's our email. You can call me. You can text me. Here's my office hours, which I'm just sitting there waiting for you to come talk to me. That being said, please contact me before, just to make sure I'm there and not setting up the sim lab or in sim or doing another meeting that day. But as an overview, we kind of talked about some of the stuff that's related to pediatrics. So this is our course description. This is a lecture type of course with clinical hours, and this is what that means for you. On-ground participation, I do expect you to show up for class. I do expect you to be there, sitting there, paying attention, interacting. I can't guarantee you'll have a good time, but I will do my best. Learning objective, we kind of talked about these before, but this is what we're really looking at for these kids. Theoretical basis, this is why we do what we do, and this is based on the foundations of USF as well as from AACN. If you're curious about what that means, here's the AACN Essentials, as well as you can look at how we map that out and why we do what we do in each of the courses. So resources required, APA book, it's a nursing course. Of course, APA is part of it. Your ATI book, and then you've got your pediatric book. So all these are required. Evaluation. So with the evaluation, we've got lots of things that we'll do in this course. You're going to have 3 exams. Each one's only 21% each, but total at 63 points, which is significantly less than like a med surg, but still significant in what you want to do well. You'll do a family interview and an assessment paper. You'll do a physical and developmental assessment on a patient. You'll have a teaching plan that you'll do during clinicals. You'll have 2 concept maps. You'll have some quizzes due. You'll have an online discussion question. You're going to have some soft chalks that are due. You're going to have simulation and some class participation points. You'll have soft shock modules, like I said. You're going to have ATIs, both practice with remediation and proctored with remediation. And then you'll have your culture for service and service learning. So I'm kind of expecting that you've seen all these different formats before. If not, please contact me for further details. But I don't think that we're going to waste time with this, because I think that you've seen a lot of them. Concept maps will do a little bit more discussion about in the class, and I'll provide you with a discussion, and we'll go through it in class so you have an understanding of what that one is. So, clinicals, you get to go to the PEDS floor, you have simulation, you're going to go to the Health Connect Fair, you're going to have a conference that you're going to go to, and then a teaching plan that you'll do during clinicals. Online discussions, be nice, be meaningful. Don't just do the same old thing of, really, Jane, I really appreciate your post. I also agree with this, this, and this. It's amazing how this is part of pediatrics. Doesn't really say much, doesn't add to the conversation. You will get doc points for that kind of stuff. I need you to expand upon it and add more meaning to it. Comfort Pass, we will have Comfort Pass in this course. You get 2 chances or 2 options if you want an extension for a week on some of your assignments. With this, no questions asked. You don't have to tell me why. I'll just grant you an extension. You just got to get in by December 1st, because that's the end of the semester. I need to be able to grade it and do those kind of things. But if you need an extension, just let me know. It's got to be due. You got to talk to me before the due date, but I'm happy to grant you that extension. Grading scale, similar for all the other nursing courses, so A's, B's, C's. You do need a B- to progress within the nursing program. Service learning, you will have a service learning project. Some of you are doing the immunization clinic at Gorman, and I appreciate that. For others of you, depends on what you're all doing, but we can talk about that later. I have a feeling you understand service learning, but this has got to be something that is for the greater good of the community. It's not babysitting your kid or your sister's kid, because that's not the intent of this. If you need ideas on this, please come see me, and I'm happy to discuss some other options with you. Academic honesty, please don't cheat. If you have questions about what this means, please look at this. ADA, if this fits you, please talk to the Academic Success Center, and I'm happy to work with them and you regarding this. Program assessment, at the end of the course, you will see that we will have IDEAs again. I'm always open to suggestions. If you have suggestions that you want to give me before the end of the course, that's always nice. And I take that seriously, and I try to improve my course every semester. Copyright, make sure that you're giving credit to where it's due. Make sure you're providing references and citations when appropriate. Status of the syllabus, I've done this for a while, and I expect that this to be fairly locked in, but if there's a change in the syllabus, I'll let you know. Now, looking kind of at the class schedule, it goes week by week, and this is kind of a good format for it. Like I said, initially it's laid out with more theory and development, and then it's going to go into more of like a med-surg type of thing where it's more system-based. So, initially, I want you to listen to this lecture, which you're doing. Congratulations. We're also going to be talking about 21st century peds, and I'll get some of these online lectures recorded as well. So I want you to complete these on soft chalk, go through them, get your points for it, and then I'll discuss them here. Also, some other assignments, make sure that you know your clinical orientation is done, Castle Branch is up to date, Sanford 1 chart is all up to date. I know it's really busy for the first week here, but those are important things that we need to prove to Sanford and Novera and everybody that you are ready for clinicals. Starting week 2, we get child development, and so we're going to be talking about family, social, cultural, and religious influences also on kids. Make sure from this point on that you're doing your soft chalk modules before you come to class. The reason why I do that is so that you can understand some of the content that we're talking about that week. So, and then there'll be some online discussions Have to have your initial post in on Wednesdays, and then responses due on Sundays. Following week, of course, is Labor Day. I'll record some more lectures for communication, history, and physical assessment. There's a soft chalk with us as well, and then some quizzes with us. Then we meet in person again. We'll talk about family theory, and then we'll slightly get into respiratory dysfunction. We'll also talk just kind of some open class time to talk about the exam that's coming up, covering weeks 1 through 3. And then we'll talk about the Health Connect Fair, which is part of your clinicals, which I'll talk about in a different presentation. So week 5 we'll do exams, so that will be the first part of the class for that week. And then afterwards, then we'll talk about respiratory. During this week also you'll have discussions and a forum posting regarding the Health Connect Fair and what you experienced. Now we're moving more into those system-based, so we talked about respiratory, we'll talk about cardiac. So with that, you can kind of see some repetition here with soft chalk modules. For your clinicals, you will have concept maps due. So concept map 1, concept map 2. You're going to have some simulation journals due. But then we're talking about a lot of hematological and immunological dysfunction. Child's Voice Conference is coming up. That's part of your clinical time that I expect you to be there for, and we'll talk about that in the clinical presentation. There's quizzes this week. There's soft chalks this week. Moving on, there's fall break, the early part, but then this is going to give you some time to get some of your stuff done. So this is a nice week for you to wrap up your physical and development, child abuse conference discussion, family interview and assessments. So it worked out pretty well with this, and I'm trying to give you this week to wrap these clinical assignments up. We'll talk about the cerebral dysfunction, so that's neuro. So talking about those kind of things. There's a quiz here, and then exam 2. So after the exam, we'll start talking about endo. We'll talk about pain, soft chalk modules with those before class are due. Then we'll talk about GI and gastro with soft chalk modules. We'll talk about PEDS Med Calc. So this is going to be a proctored Med Calc that you'll do in class, and you'll have remediation on it. This remediation will be a little specialized, and it will vary depending on how you do. That being said, do well on this Med Calc ATI, and you'll have much less remediation to do. Then we'll talk about neuromuscular and musculoskeletal with associated soft chalk modules. We'll do you have ATI practice tests to do, and the remediation with those. Moving on to right before Thanksgiving, we're going to talk about chronic illness, disability, and end-of-life care and pediatric emergencies, with some soft chalks and quizzes for that week. Note, I did put a quiz week for over Thanksgiving. I'm not trying to be a jerk about it. Some people like to have it over breaks. Get it done before if you don't want to have it over Thanksgiving break. It will be open early, and by all means you can do it early. Week 15 is talking about cognitive sensory, and then we'll do a proctored ATI. And so soft chalk with that, ATI remediation due that Sunday, culture for service learning due that Sunday, and then it's finals week. And so this class is going to fly by, and I think it's going to be fun, hopefully, for you, and you'll learn a lot. Going through some of the LMS aspects of this course. So we covered syllabus, some of the orientation, which will be here, and you're going to see that, roadmap. So this is talking about some of the things that you've already had in some of your courses, so hopefully you know about these type of situations. But once again, office hours, ways to contact me, other support if you need it. Going through the different types of headings here and references on the left-hand side, course information, talks about this course and ways to contact me. Clinical schedule we'll talk about in a different video. Attendance, I want you there. The reason why I want you there is because students that are in attendance do better historically. So, and plus it's fun. I want you there. It makes it more fun for me. It makes it more fun for the class. Resources, so a variety of different things, both with downloads and with some links. Soft chalks are generally linked over here, and that's for trial runs and for no points associated with this. Also, a big component of this is the Child Abuse Conference link is right here. You need to sign up for the Child Abuse Conference and select which presenters you want to view. This sign up will make it free to sign up, but then you will need to pay the University of Sioux Falls nursing department $75 for the conference. This conference is incredible. It is a wonderful conference on an awful, horrid topic. But I love it so much in the fact that this gets you real-world experience to real-world problems, and it gets you to open up your mind and see all the different people that help care for these kids. So you're going to see lawyers, you're going to see officers, you're going to see providers, nurse practitioners, physicians, social workers, teachers, and there's a lot of different moving parts onto how many people actually care for kids and try and combat and diffuse abuse. So make sure that you do this soon. We'll talk about it the first time we meet in person. But there's going to be different resources like hormone charts and clinical forms and links and readings for you to do. Sim prep. Some of you have got sim prep coming right up. Make sure that you do this and fill this out prior to. I know it's a little arduous, but it will help you so much during your simulation prep or during your simulation. Let's see here. We've got all these soft chalk modules that we talked about before, some different templates that we'll use throughout the course. I put out study guides. I realize that they're generic, but it will give you some guidance as to topics that will be covered. And if I can, I like to run through these before the exams. I can't always guarantee that we'll do that, but I do like to try and open the class up for some questions. For some of the content, we will have some recorded lectures here, and that's where you'll find some of the details. Coursework, these are where your assignments are. These are where you're going to see the grades for this. Soft chalks are located here, as well as general assignments. So the soft chalks, I think you have an understanding of. You click on the soft chalk link, go through it, fill out any little questions it has for you, and that's how you get credit. And that's how I know that you've looked at this stuff before you get to clinicals or before you get to class. Down below, like I said, these are some of the things that we've talked about on the syllabus. So, CASA branch, you have to make sure that this is updated, including contact information that will expire on September 1st. So make sure that you update that. Clinical orientation, so that's going to be a soft chalk module that's special in talking about Sanford and Avera and clinical requirements. Sanford training, I got to make sure that you're up to date with that. Skills Blitz, which you will have here on August 22nd, 23rd. And it's going to talk into more standardized assignments. So this will be kind of discussion questions, so this is a forum for you to start with. Quiz, concept map, and we'll talk about that a little bit more in class. It is like a patho flow sheet, except it's a little bit messier. So you type A personalities will not like this, and I apologize for that. However, it's good to see how complex your patient is. It's also good to see how many different things interact with each other and really are considerations that you need to have when caring for patients, both in pediatrics and once you graduate. Pediatric nursing exam, you guys have had exams before, you know what those are. We'll talk about those in a little bit. Health Connect Fair, we'll talk about that during clinicals and the clinical discussion video. There will be a teaching plan that you'll need to do for post-conferences, and we'll talk about that in the clinical recording. Concept Map 2, you'll have a sim journal, so a brief write-up after simulation. There will be another posting here talking about Too Small to Ignore. There is a book in the library for you to read, and it'll be on course reserve. Read it and then make your posting here. You'll have some quizzes, family interview and assessment. So this is where during your clinical time, you'll talk to a family. And I've got it laid out for you, the questions to ask, and you're just going to do a write-up. You know, how are they doing? Do they have enough food to eat? How are they with healthcare? Who makes the decisions in the family? How is this hospitalization impacting them? Are they ever thinking about having more kids, etc., etc., etc.? And so this family interview and assessment paper, this is meant to be done in a group, so you'll take about half of your clinical group and break into different groups and be able to write up this paper. Physical developmental assessment, you can do this as a group, but I want you to do your write-ups independently. So it's an H&P just like you did for Med Surg and Fundamentals. It's just on a kid. Post-child abuse conference discussion. So after you go to the conference, you'll have a discussion forum post here. Case study will be in class, quizzes, exams. This is your ATI Med Calc, and you'll do remediation on that, and the specifics of that are in this. ATI Practice Assessment and Remediation here, which you've done some of the ATI practice stuff before. Quiz, ATI Proctored, Cultural Service Learning, which you've done before, and then the final exam. So as the course progresses, we'll talk a little bit more about some of these exams, and we'll talk about some more about these assignments, but I'm not going to bother you with that, with just this overview. If you've got specific questions, of course, come talk to me, and I'm happy to discuss it with you further. Gradebook is here if you want to look at your grades. Forum postings are here, and roster is here just so I can see who's all in my course. So this is a brief overview, including the syllabus of what pediatrics is and what you're going to be encountering for this semester. Of course, if you've got questions on this, seek me out, call me, text me, email me, talk to me during office hours or during class time. So I look forward to having you in class, and I think it's going to be a fun semester. All right, have a good one.